Okay, good morning, students. So today I will be discussing with you all about the remaining portions of nephritic syndrome, which we have discussed yesterday. Okay, so what was the last class? What was the last topic that we discussed yesterday on nephritic syndrome? What was the topic?
Methodology. The methodology.
Okay, okay. This was it, isn't it?
Yes, ma'am.
Okay, okay, okay. So yesterday we already discussed about these two causes, so I won't repeat anymore. So the next causes is glomerulonephritis. Okay, so the next causes of glomerulonephritis that we will be discussing is the main causes of this type of kidney infection is unknown. Okay, like what is the main cause? Means we know that glomerulonephritis means if there is inflammation occur in the glomeruli, then it is known as a glomerulonephritis. Now, so how that inflammation occur in that glomerula till today? Okay, the main causes for what reason that glomerulus was inflamed, the main reason is not yet known. Okay, there might be certain like a partial reason, but the main reason is not yet known and it's unknown. So however, there are some condition, okay, that may encourage an infections, including, let us discuss one by one, including the problem in the immune system, and there might be a history of cancer, or there might be an abscess that breaks and travel to the kidney to the blood. And so like even if you don't know the main causes, okay, of that kidney infections, okay, but still there are some conditions, okay, that may encourage an infection. So these are the some of the other conditions so that cause glomerulonephritis. So these are the one, any kind of problem that occurs in our immune system, okay, that makes our immunity weak, all those things. And then any kind of this carcinoma, any history of carcinoma, that is any history of cancer. So if there is an abscess, okay, that breaks, and the abscess that breaks and travel to the kidney, okay, and how does it travel? Those abscess, it will travel through the blood. So you all of you know now what is abscess. Can anyone tell me the meaning of abscess nicely? Abscess? A-B-S-E-S-S. It's very common, abscess. Any one of you? This class was already taken, so can you please tell me what is abscess? What is abscess? Means abscess means it is like a pus, okay? Like it is a painful collection of pus. There used to be a pus formation, okay? So if that particular pus, the PUS, okay, if that particular pus, that is the painful collection of pus, if that pus break and travel to the kidney, okay, through the blood, then that also the other condition, okay, that encourage an infections. So for example, like how do we call this boil? You know now what is boil? Boil? Yeah, when boil job, like when that boil, when it breaks down, what happens? Some kind of fluid, yellow fluid or blood or something used to come up, no, in that type of this collection of pus is known as abscess. So this was all about the causes. So Srijana, what did you ask yesterday? I totally forgot the questions. Yesterday you asked some questions.
What is the leading cause of acute nephritic syndrome?
Can you please repeat again slowly?
Ma'am, what is the leading cause of acute nephritic syndrome?
Who is there? Don't make noise. Okay, a leading cause of nephritic syndrome, acute nephritic syndrome. You are asking me that question.
Yes, ma'am.
Actually, I guess that there is a slight typing mistake, okay, in that questions, I think, because it was not prepared by me, na, that question. So the question, it should be like, actually, every causes is the leading causes, because mainly what we know in the nephritic is that is the inflammation. Na? When the inflammation mainly occur in the glomeruli, from the introduction itself, we got na, that inflammations that occur in the glomeruli, then it is known as glomerulonephritis. So these pyelonephritis, glomerulonephritis, interstitial nephritis, all these are the like the leading or the common symptoms, or the common causes of all this acute nephritic syndrome. Okay, so we cannot mainly term as like the leading cause. What is the leading cause of acute nephritic syndrome? Understand? So I think that question was, it should be like, what was the leading cause of pyelonephritis? Then that would be correct. You get the questions?
Yes, ma'am.
Yeah, because that question was not prepared by me, so I did not view it now. So okay, let me check one more time. Okay, I think it's still in there in my phone. Oh yes, what are the leading cause of acute nephritic syndrome, isn't it? So it should be like, what are the leading cause? If the option is based on that, then it should be, what are the leading causes of pyelonephritis? Okay, Srijana.
Okay, ma'am.
Okay, thank you for this pointing out this question and all. Because if I would have prepared that questions, then before that I would have means view it now. So it's very good. I will correct it next time. I'll inform your ma'am. Okay, so these were the causes. Till today we have whatever causes we have discussed, that we have discussed the three types. Actually there are lots and lots of type of nephritic syndrome. Now it's not that we have discussed three types, so it's only three types. So if we keep on discussing it, it won't end. So we are just discussing some of the common types and as well as some of the common causes. Okay, so that is interstitial nephritis was the number one. Next is pyelonephritis, and the other one is glomerulonephritis. So these were the causes, and all this, if you want to learn, then there are some of the common causes, okay, of acute nephritic syndrome in children and adolescent. Okay, all this hemolytic uremia, all these are not necessary for you in now, means like for your final exam and all, it's not required. But in case if you want to learn it more, okay, for your knowledge, then this is, you can take it. These are also like common causes in glomerulonephritis. Also like there are also some other common causes, okay, that is post streptococcal glomerulonephritis. Okay, these are the kidney disorder that occurs after infections with certain strain of streptococcus bacteria. So this type of like kidney disorder, that it occur after infection, okay, with certain strain of streptococcus bacteria. All this, if you want to know it, then I will send you all the PDF in case if it required, but all this will not come in your final examination. So these are also the common cause in adult, okay? Abdominal abscess, all this Goodpasture syndrome, this lupus nephritis, all this, okay? These are the kidney complication of systematic lupus erythematous. All this I explained before, what is lupus and all. And any kind of viral disease such as all these measles, mumps, all these are also the common causes of acute nephritic syndrome, okay, that we find in adult. So if you want to know it, but this also I will not include in your final. But in case if required, then you can just write it down. So let's know after causes, what was the point? After causes, what is the next in your notes?
Risk factor, ma'am.
Okay, let us discuss the risk factor. So certain peoples are at greater risk for acute nephritis. Okay, we will be discussing some of the risk factor for acute nephritis. So first of all, like a risk factor means like what is the main meaning of the risk factor means apart from all the causes, apart from all the causes, okay, there are some person who are more susceptible to have all these kind of infections. So let us discuss one by one. So number 1 point is a family history of kidney disease and infections. So suppose one of the family member is suffering from any kind of kidney disease. Okay, so that that may be like because of genetic also, means a family history of kidney disease. So maybe like his father or his mother or her mother or her father have been infected before, okay, have already been infected with all this kind of kidney disease and any kind of kidney infections, okay, all this. So the family, because of family history also, you can also develop, okay, genetically you can also have a kidney disease. So this is the first risk factor. So coming to the next point, having an immune system disease, okay, such as lupus. All this lupus disease, all this, what happens is that it decreases our immune system, okay. So having an immune system disease, those people who have this is kind of this lupus erythematous, now all this systematic lupus erythematous disease, all this that make their immune system weak because of this immune system diseases and all, okay, all those people, they are much more like susceptible to develop all this nephritic syndrome. And then coming to the next point, next is taking too much or too many antibiotic or any kind of pain medication. So there are certain medication and antibiotic, okay, because some people are like, some people, it's not that they have a kidney problem, okay, it's not that they have a kidney infection. So they maybe some people have diabetes or whatever, any kind of chronic renal disease or whatever it is. So when they have taken a lot and lots of antibiotics and a lots and lots of pain medication in order to relieve their pain, in order to relieve their fever, all this, okay, all this excess overdose taking of this medication can also lead to acute nephritis. And these people are much more like much more have chances to develop this nephritic syndrome. And next is recent surgery of the urinary tract. Obviously, if anyone have this recently, like surgery of the urinary tract, then that person is much more susceptible to develop this acute nephritic syndrome. So these are some of the risk factors. So there is a 4 point of risk factors. So are you clear? The all the causes and all the risk factors?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. It's easy, actually, it's simple. The only thing is that you need to understand, that's all. So the next is clinical features. So the clinical features, the symptoms will vary depend on the types of acute nephritis. Obviously, the symptoms will vary because we have discussed the 3 types, it's not it. So based on all the types, it might be like glomerulonephritis, it might be pyelonephritis, interstitial nephritis. So based on all the types of this acute nephritis, the symptoms will be different, but we will be discussing the overall symptoms. So the most common symptoms of these 3 types of acute nephritis are, because even though they have the different types, but almost their symptoms are common. So that is why we have jotted it down all together and we will be discussing. So number 1 point is the pain in the pelvis, okay? There will be pain in the pelvis. This kind of symptoms you will see, okay? If a person suffer from acute nephritic syndrome. So pain in the pelvis. Again, dysuria. So dysuria, what was the dysuria? What was dysuria? Srijana, what is dysuria?
Burning sensation during menstruation.
Yes, okay, very good. There will be pain in the pelvis, there will be dysuria. That means these are the common symptoms, okay? You will find in the pyelo, you will find in the interstitial, you will find in the glomerulonephritis, everywhere. So Stranguri, this also I give you all. So can anyone tell me what is Stranguri? It's already given to you all still. Anyone, Ilasara, would you like to say the answer? What is Stranguri?
Painful desire to pass urine although the bladder is empty.
Yes, very good. Okay. They will have the desire to pass the urine, okay, even though this bladder is empty. So, and then next is hematuria. No need to repeat this, hematuria. And then cloudy urine. So the urine will not be like it will not be clear, okay, it will be cloudy. So there will be pain in the kidney area. Obviously, if there is any inflammation, because we are mainly discussing about the nephritis, okay, that is all the inflammation. So if there is inflammation in the kidney itself, then the area of the kidney, okay, the surrounding, the neighboring, all those will, the pain will occur in all those areas, as well as your abdomen. So this kind of feature you will see. And then again, or edema means, this edema means, you know that the edema, this is the accumulations of any kind of fluid present in our body. So this kind of edema we mainly see in our face, in our legs, in our feet. So this kind of symptoms or the features also we see in a person who suffers from acute nephritic syndrome. So coming to the next, the nausea and vomiting. So these are very common: nausea, vomiting, and fever, hypertension, all these things you will see. So these were all the like common symptoms that which we find out from all the 3 types of acute nephritis. So you all understand all this point? Anyone have any questions from this given point? किसी को कुछ पूछना है from this point, that कुछ point समझ में नहीं आया? Anyone want to ask any question?
No, ma'am.
Okay, let's move on then.
Oh, ma'am.
Okay, let's move on. So diagnostic, okay. Diagnostic evaluation. The physical examinations are to be taken when the diagnostic evaluation, you just listen carefully, okay? This is very, very important. So the physical examination are to be taken when the medical history of the patient is suspected in increased risk of acute nephritis. So urinalysis. So urinalysis in Samuel, in urinalysis means what? Urinalysis. उसमें क्या टेस्ट करते हैं? We test the blood or the urine, or what we do in urinalysis?
Yes, ma'am.
Yes.
Hematuria, ma'am.
Pardon? In urinalysis, what is the meaning of the term urinalysis?
Ma'am, यूरिन में ब्लड है कि नहीं उसको टेस्ट करते हैं.
Only blood. Only blood.
Not only, ma'am. Bacteria.
Yeah, all
WBC.
these features. So when people ask you now, what is urinalysis? So you have to simply say that it is the test that is done. Okay, test done for urine test. Okay, urine testing. You can just simply say urine test. If you want to replace term urinalysis, you can just say urine test. Understand, Samuel?
Yes, ma'am.
Okay, okay. So whatever point you mentioned were all those investigation, okay? It was not wrong, but the main term is urinalysis, the meaning. So in urinalysis, that is urine test, okay? That so this urinalysis, it is mainly done, okay, to check out these hematuria. So these are all these urinalysis, urine tests, all these are mainly done in the laboratory, okay? It is done. So what we find is hematuria. We find hematuria, and then bacteriuria, and then WBCs. So all these are the investigation results that you can find if a person have acute nephritic syndrome, or in order to diagnose the person suffer from acute nephritic syndrome or not, you have to perform all these investigation, all these diagnoses. That means you have to check the urine, okay, whether there is any presence of blood or not, presence of bacteria, if there is any presence of WBC, all this you have to check it. And if you suppose you check the urine of a person, okay, of the infected person, suppose you check it, okay, you check, suppose you have taken your urine and you have given your urine for testing, and you find that you have hematuria. That means you have blood in your urine, and you have bacteria in your presence in your urine, you have white blood cell present. If you find all these things are present, okay, in the investigation results, then that will indicate that you have an infections. So that is how it is done. So coming to the next is blood test. So there are 2 important indicator, okay, for performing this blood test. Those are BUN. So what was the full form of BUN? Virginia, what was the full form of BUN? Miss Virginia, what was the full form of BUN? Is Virginia there? Okay, Ishan, can you please tell me what is the full form of BUN?
Ma'am, blood urea nitrogen.
Very good, Ishan. Okay, it's blood urea nitrogen. Okay, so these are the like indicator, okay, that you will find while performing this blood test. So BUN and the other one is creatinine. Okay, the other one is creatinine. Okay, this BUN, that is blood urea nitrogen, all this creatinine, all these are the like waste product, okay, that used to circulate in our blood. So ये सब waste product है जो हमारा like blood पे circulate होता है. And then what does our kidney do? The kidney our kidney are mainly responsible for filtering them. Okay, all these BUN, blood urea nitrogen, all this creatinine, all these waste product are mainly filtered by our kidney. Okay, but if you find while performing the blood test, if you find that there is increase in BUN, okay, there is increase in the number of this blood urea nitrogen, and if you find there is increase in the level of this creatinine, all this, that indicate that your kidney is not working properly. That means there is some inflammation or there is some like damage in your kidney. So that is how the blood test is done. So next is radiography. This radiography, this is an imaging scan. Okay, this is an imaging scan, such as CT scan is done. And then Srijana, what was the full form of CT scan? CT?
Ma'am, computer tomography.
Okay, see, computer tomography, CT scan is done, and then again ultrasonography is done. Okay, so what happens is that when this imaging scan, okay, such as this CT scan, ultrasound, when all this scanning is done, what happens is that it shows a blockage or any inflammation of the kidney or urinary tract. Okay, so all those are the signs of all these signs that indicate that a person have some problem in his or her kidney. So if you find after doing the CT scan, after doing ultrasound, if you find there is some blockage or there is some inflammation in your kidney, that indicate that a person might have this acute nephritic syndrome. So are you clear? Everything, like why urinalysis is done, then how blood test is being done, how radiography is done, if it is done, what type of problem you might see. If you find all those problems, then that indicate what, that this true, it will indicate infections. Okay, so this true, what it indicate, I explained this also, what it indicate, all this I explained. So are you clear with urinalysis, blood test, and radiography? Yes or no? All of you? Are you clear?
Yes.
All
Yes,
of you?
ma'am.
Okay, okay.
Ma'am. Yes,
Okay.
ma'am.
If you want to ask, you can just ask me on the spot. Okay. Okay, next is number 4 is renal biopsy, which I keep on explaining. Okay, biopsy, you know that some from your kidney itself, some amount of tissue is taken out from from your kidney for further investigation. Okay, and that tissue is being that tissue is taken into the lab and it is observed under the microscope, which I already explained to you all many times. So renal biopsy, this is one of the best way to diagnose acute nephritis. Okay, because you are directly taking this tissue, okay, the sample of tissue from your kidney. So this, then it will be very easy to diagnose a person that he or she have inflammation in his kidney or not. So this is all about renal biopsy. So are you clear with the diagnostic, everyone? Till 4 point? All of you?
Yes.
Yes, ma'am.
Okay,
Ma'am.
then no need to repeat again. Okay,
Yes, ma'am.
let's come to the management. So management. So all of you have notes now of this management. So you can just turn up your notes and you just see it. So if you want to add something or like If you want to modify something, you can just see my slide and as well as your notes. So what happened is that, okay, so there are some medications that will help you all in managing the person who suffer from acute nephritic syndrome. Okay, so what is the first medication? Let us see. Antibiotic. So yes, we keep on saying that antibiotic. Okay, if there obviously there you find in pyelonephritis also that inflammation was mainly because of the bacterial infections. So antibiotic, that is the reason why all these antibiotics are mainly given to treat the kidney infections. Okay, if there is any infections. So all of you have notes now of this? Yes or no?
Yes.
Yes, ma'am.
Yes.
Yes, ma'am.
Okay, Srijana, you can take attendance, okay? Okay, so antibiotic are
Okay,
mainly given to treat this kidney infection, okay? And then what happened is that if you have like if you have the serious, if your infection is very serious, okay, the infection, because when you have kidney infection you are prescribed antibiotic, but what happened is that when that particular infection is very much serious, okay, you might require antibiotic, but that antibiotic should be infused intravenously. So that is IV antibiotic, because you might have a question now in number 1, antibiotic is already given, so why this another IV antibiotic is also mentioned again. So the first antibiotic that is mentioned is the pill, that in the tablet form, the pill, that antibiotic pill that you used to take now, all those in a tablet form or in a pill form. That is the number 1 point. And the number 2, that is IV antibiotic, that is we directly give through vein, isn't it? IV means intravenous. So this, when this is given, it is mainly given when a person is having a very much serious infections. So are you clear the difference between these two?
Yes, ma'am.
Okay. And then in order to give this IV antibiotic, what happened that the patient mainly used to be hospitalized, okay? Hospital pe hi zyadatar dete hai, because all this IV intravenous saline, all this like it's quite difficult not to treat a person at home. So orally so you can take anywhere, but this when injection takes place through IV, it's quite difficult. So mainly inpatient setting, hospital inpatient setting is preferred. So this why this IV antibiotic, okay, this is also antibiotic, this is also antibiotic, but this IV antibiotic, as we gave the antibiotic through intravenous, through our vein directly, so it used to work faster than this antibiotic that we used to take in pill. Okay, so don't ever get confused कि कौन सा ज्यादा जल्दी काम करता, कौन सा वाला slow से काम करता, all this. IV antibiotic is faster. So are you clear about this too? Yes or no?
Yes, ma'am.
Yes,
Yes, ma'am.
ma'am.
Okay. So corticosteroid, I already explained you all in this nephrotic syndrome when I explained about the corticosteroid. So corticosteroid drugs, this class of drugs was mainly given for which type of patients? So if they have like infection or if they have fever, or for what purpose these were given? Any one of you?
Ma'am, inflammation.
Yes, very good. It's given for inflammation, okay? Corticosteroid means if your kidney are inflamed, okay, it's your kidney is very much inflamed, then obviously your doctor or else your physician will prescribe you to take this corticosteroid. जब इंसान का inflammation kidney पे होता है तब corticosteroid drug prescribe किया जाता है. So that's all about the medication. So next, coming to the supplement. So if we can't complete in this class, the next class, again, I have class video, I will continue this and I will try to give you all some of the questions. So next is supplement. So when the supplement, so when the electrolyte level is increased, okay, the supplement, when the electrolyte level is increased, what happens is that IV fluid is prescribed, okay, to encourage the kidney to release extra electrolyte. Can you hear, student? Can you hear my voice? Can you hear my voice?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so this supplement, okay, you just see this supplement. Means like when your kidney, okay, when your kidney are not working properly, what happens is that that can impact the balance of electrolyte in your body, okay, क्योंकि हमारा शरीर पे हमारा जो किडनी है, जो हमारा organ है, वो अच्छी तरह जब काम नहीं करते हैं, तो क्या होता है कि that will affect the balance of electrolyte in our body, okay. What are the electrolyte? We know that the electrolyte are such as potassium, sodium, magnesium, etc. There are lots of electrolyte present in our body now. So when our kidney is not functioning properly, so it can have impact on all those balance, okay. So अच्छी तरह balance नहीं हो पाता. So that is why we find the electrolyte level is also increased, okay. So when your electrolyte level, that is when your potassium, sodium, magnesium, all these level are increased, what you need to do is that you need to suggest the patients to have or to have intake of IV fluid, okay. IV fluid is mainly prescribed to encourage the kidney to release extra electrolyte. So because you in your body you are having an increased level of electrolyte ना, हमारे शरीर पे बहुत सारा electrolyte है, so you want to remove that excess amount of electrolyte present in your body. So what you need to do is that you need to suggest a person or a patient to take IV fluid, okay, and this IV fluid will encourage your kidney to release all those extra fluid that are present, extra electrolyte that are present, okay. You understand? Yes or no? All of you?
Yes, ma'am.
Okay. Next, when the electrolyte level is decreased, okay? When the electrolyte level, जब electrolyte high हुआ, तो हमको क्या करना चाहिए था? IV fluid देना है, हाँ? तो so that we encourage our kidney to release extra fluid. But when our electrolyte level is decreased, what we need to do? Potassium or phosphoride pill is required. So this potassium or else the phosphoride pill is means like suggested a person to have intake of this, okay, in order to build or in order to make the electrolyte balance. So these are the supplement taken, okay. And when you have all these like problem, electrolyte imbalance and all, you can't just take any kind of supplement, okay, without having consultation to the physician. You can't just take any kind of supplement. So these were all about the medication and the supplement. So are you clear with these 2 points? Number 1 and number 2, are you clear?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, let's move on. Next is dialysis. Okay, dialysis. Dialysis, I gave you a very, very nice definition also for this dialysis. So if the kidney function is significantly impaired due to infection, okay, dialysis may be required to improve kidney function, okay. When, Srijana, are you done with the attendance?
Yes, ma'am.
Okay. So when what happens is that when our kidney function is impaired, obviously if there is so much inflammation in our kidney, then the function also will be impaired, okay. So if when your kidney function is impaired because of infection, okay, because of certain kind of infections, so in that case dialysis may be required to improve your kidney functions. And some people take like temporary dialysis, okay, कभी-कभी dialysis लेते, temporary dialysis, when their kidney is not that much inflamed or that much damaged. But when a person kidney is totally damaged, okay, he might require a permanent dialysis. हमेशा dialysis पे ही depend भी कर सकते हैं. So all those kind of things are very much dangerous. So next is home care. So in this home care, I will continue in your this next class, which you will be joining again. So because it's only 1 minute left. So you all understand whatever we have discussed today till here? All of
Yes,
you?
ma'am.
Yes, ma'am.
If you have
Yes,
any, if
ma'am.
you have any question, you can just ask me. Okay? After 10 minutes, that after 10 minutes, you will you join again. I'll send you the message when to join again. Okay, thank you everyone.
Thank you,
Thank you,
ma'am.
ma'am.